cord blood is the blood that is left over when a baby is born, that is left in the cord, the umbilical cord and the placenta. So it is blood that has come from the baby that is remaining after delivery. And when we clamp the cord, the umbilical cord, the baby at the time of delivery, then there is a certain volume of blood that is still remaining in the umbilical cord and the placenta. And the reason that some people collect cord blood are for a couple different reasons. Routinely, we think about collecting cord blood for cord blood banking, but we also sometimes collect cord blood for research purposes. So those would be the kind of two main reasons. The reason that people bank the cord blood is that cord blood can be used for a few diseases to make a treatment for that disease. So certain types of blood or immune system diseases, certain blood cancers like leukemia, etc., may be able to be treated by cord blood stem cells. And so for that reason, folks are interested in collecting those cells. Cord blood is collected at the time of delivery, and so when a baby is born, the umbilical cord that connects the baby from its umbilicus or its belly button to the placenta, that is clamped and cut. And so the baby is delivered, and then you have the placenta still inside the uterus with the umbilical cord. And you can either collect the cord blood before or after the placenta is actually delivered. But the important part is that the umbilical cord is cleaned off, and a needle is used to insert into the umbilical cord. And that needle is attached to tubing that's attached to a little bag, a sterile bag. The sterile bag hangs down, and the blood is collected out of the umbilical cord and placenta and flows into the bag. The bag is sealed off, and then usually the placenta is delivered. So usually the prenatal provider, the obstetrician, the midwife, or one of the nurses who's there at delivery does the cord blood collection. And the cord blood collection kits are prepared and sent to families ahead of time, ahead of delivery, and the families then give those to the prenatal providers to make sure they get their cord blood collected. The important thing to know about it is that for yourself, your child, your immediate family, the chance that you will use that cord blood is pretty remote. It's been estimated that about 1 in 2,700 cord blood samples that are collected or banked will be used if they're collected privately, meaning will be used by your family or your child or siblings of your child. So not everyone wants to go the private collection route because it's expensive. It costs about $2,000 up front to bank cord blood privately, and then the yearly fee is about $125, sometimes a little bit more, that you'd have to pay every year for that blood to continue to be stored. So it's expensive. And so when patients understand that the chance that they're going to use it is remote, not everyone feels comfortable with that decision. Now, cord blood still can be important, and so the public banking is really taking off, certainly as a good option. And the reason public banking is important is that anyone can go to that bank down the road and see if they're a match and try to use the publicly banked cord blood. So collecting cord blood for public donation, which is free from your child, is a good way to contribute to the health of others in the future who may need that cord blood. Cord blood is sometimes collected for in research studies, and it may be collected down the road in the National Children's Study. It's an important source of information for research about moms and babies, because cord blood is a way that blood can be sampled from babies without actually drawing blood from the babies. It's blood that was going to be thrown away. So at the time of delivery, the blood left over in the umbilical cord and placenta. So it's a really good resource for being able to look at the baby's hormones, biologic markers, genetics, without having to draw blood from the baby. So it certainly is a good resource. And for women and families who want to participate in research that's going to help improve outcomes down the road for other moms and babies, and to understand more about diseases that affect moms and babies, being involved in research that utilizes cord blood is a great opportunity to do that. So those are the uses of cord blood, and I think that it's important to understand what your options are. Patients will get a lot of information about cord blood, and a great resource for folks is to talk to their prenatal provider and ask them for additional questions. They sometimes have pamphlets they can go and look at. Another good resource is the American College of OBGYN, ACOG's website. They have information for patients about cord blood banking and cord blood collection.